silence.
Amazing. Uganda's suicide rate for 2016 was 4.70. Now, there was a zero increase from 2015. But then when it got to 2017, the suicide rate did increase as well. When it got to 2018, the suicide rate did increase. When we got to 2019, 4.60 suicide rate, and there was an increase of 4.55% increase. A very good morning to you all. Now, do I have your attention? If you have not had a relative that commits suicide, you are about to have a relative committing suicide, or if not, you are planning on committing suicide yourself tomorrow or any other day. A very delightful morning to you all. This is Volume Up, and my name is Simeo Sebukulu. Now, the month of August is taken that far, and today is the 30th of August, and it's a Monday. Welcome aboard, ladies and gentlemen. We promised, and certainly we're here to deliver. With me in the studios is Dr. Hafsa Lukwata from the Ministry of Health. Now, the lady that you are seeing seated between the two of us is responsible for 45 million brains and minds of Ugandans. Now, that doesn't sound so easy a job, and that's why we have her aboard. But also, I have a civil society mind coming through, because Mr. JohnMary Ssekate is national coordinator of the National Association of Social Workers of Uganda. Welcome aboard, lady and gentlemen. Happy to see you. This is Volume Up on XL TV. We want to thank our audience that is watching live on Facebook. We are equally on Go TV and free to air. Welcome aboard, lady and gentlemen.
Thank you very much.
Amazing. Let's start with you, Dr. Hafsa.
Yes, please.
Now, 45 million Ugandans. Those are 45 million brains and minds. And you lead a department in the Ministry of Health that is mandated to take care of their mental well-being. That doesn't seem so easy a job, does it?
It's not at all, actually. It is not at all. Even given these times, it is terrible. And given what people put priority on, as far as mental health is concerned, it becomes very, very difficult. It's extremely difficult to actually run such a program, a mental health program, wherever. And it's not only here in Uganda, by the way. Quite a number of my colleagues in the region, even across, like in other continents, the mental health is not given the priority and the energy and everything that it deserves. And yet it is very, very important, because we know that when you're not mentally well, you will not do anything. You'll not be able to develop, you'll not be able to think, you'll not be able to relate with your colleagues, you'll not be able to even make money. It is that it is that wide, and unfortunately we do not pay attention to that very, very big and important subject matter. But I'm glad to be here, and we are pushing on. As you've said, everything is increasing, just like also the support, and people now beginning to appreciate mental health and the psychology that it goes through certain events. People are beginning to appreciate this, and we are beginning to see the light at the end of the tunnel. I seem to see improvements in this area.
Absolutely, and that brings in Mr. JohnMary Ssekate here. Now, we have it from the government side that there seems to be a challenge. That's an acknowledgement. Now, Mr. JohnMary, you hail from an association that has social workers that are termed psychosocial workers. Should we say you are complementing government in the fight for mental health in this country?
Okay, thanks very much, Mr. Simeo, and I want also to appreciate the good work XLTV is doing. First of all, to sensitize the communities about different issues, including mental health. You are really doing a very good work, and we want to appreciate management for creating this program to reach and inform, because one of the biggest challenge actually is lack of information. People have scanty information, and since it has told you that people have not been paying attention on this this big issue of mental health, then you find, of course, there is an anecdotal information, there is no good research in different areas. But of course, we have tried. People are starting now to do research. It is true, we are complementing the government of Uganda on this area of mental health, because social workers by training and practice, we are experts in behavioral change, but also we look at the person as a whole, looking at the mental well-being, looking at the physical needs and the environment in which that person works in. For example, we have been complimenting Ministry of Health during the COVID-19 hiccup. We supported them with trained social workers to go and receive those who are returning outside and support them mentally in quarantine centers around Kampala and also around what. So thanks for receiving our social workers, and we think they did a complementary role.
Yes.
We know the government may not do all, but we stand as professional bodies and also civil society organizations to complement their effort, especially the Ministry of Health, which is now leading the country in responding to COVID-19. But also we are complementing them in other areas like research. We have been doing research in refugee settlements, and reports are coming out. But also we are part of the psychosocial support pillar that is under the Ministry of Health, where she is our team leader. Yes.
Okay. Dr. Hafsa, if you are to call for a general assembly of social scientists in this country, you will have a surplus in terms of number. Number might be very, very small for them. But because the academic institutions, educational institutions, are graduating social workers, psychologists, and counselors every single year. But I mean, the absorption rate in the government structures doesn't seem convincing, does it to you?
By the way, I want to make this clear that we all don't have to be in government to actually help people out. And for the social workers especially, when I hear the word social work, I mean, it's something that has to happen anywhere, everywhere. So you do not have to be like structured within government or somewhere then for you to respond or to be able to help people out. For me, I feel people wherever they are, and even as the mental health workers, we don't have to be in any structure, because things happen just like that. Things just happen at home or in whatever situation or environment. You do not have to be very structured in order for you to respond. So yes, I want first of all appreciate, yes, the numbers are there, but I also want to, yes, affirm and say that yes, the structures are not yet very clear in the ministry or even in public service, as it were. But just like I already said, we do not have we don't have to wait to be called upon. We just have to be ready, just like the Girl Guides. Even the Girl Guides are part of us. I mean, they're just ready to respond, to help, to support, to to link. It's something that you do not have to be first told to do something. I mean, our mental health, you do not have to be told to do certain things in order for you to do them. And also the beauty about our profession is that yes, they're the very specialized people like the social workers, the psychologists and all. But the kind of care that we provide is actually care that can be provided by anyone, and mainly elders, for instance. I know that teachers, by their training, by virtue of their training, they go through some counseling skills and, managing situations. Then also the religious leaders in their theology and whatever, when they're going through their processes, their training, they somehow are able to help people out in certain ways or the other, like counseling. They can counsel, they can help, they can comfort people, they can, that psychological, giving the psychological first aid. So, and even parents, for as long as you are a parent, there's that human thing that comes in you in order for you to help and can help you to, deal with certain situations. But yes, for the experts, yes, these ones are necessary. And unfortunately, as I've already said in the beginning, that we are not paying a lot of attention to mental health. Yes, these systems are not yet in place at the ministry, in the public service sector. However, there are some improvements that are happening. We have restructured, by the way. We have restructured, and we are putting the different professions at the different levels of care. We know that we want to offer that holistic and, it's a holistic kind of care that we offer. We do not want only the psychiatrists to give their medicines and then someone goes home without any follow-up or whatever. Most of the mental health problems can actually be managed without medicines and just talk therapy, as I've said. But, yeah, these and the professionals that can be the professionals that are available for this talk therapy are actually now going to be structured and put into the system. We have restructured the Ministry of Health, I mean, especially the regional referral hospitals, and we've been able to put them there. Initially, they were not. There was just one social worker, and this one works for the whole hospital. But now we have put it in such a way that for as long as you're going to work into the mental health department, you will be able to be cared for by a special team of people. There will be the psychiatrist in case you need any medicine. There will be the psychologists, then, and moreover different levels of the psychologists. Then of course there will be some counselors, and then of course the social workers. The social workers mainly do the linkages between the health facility and the communities. And that's the holistic care. Like after you come out of the hospital, you should be able to go home, and someone should follow you up from home, and then we'll make sure that the situation at home doesn't make it worse for you to come back to hospital.
Mr. JohnMary, what Dr. Hafsa does raise an amazing and important point here, that you do not need an office in government as a social worker for you to practice social work, and you come from an association that brings together all social workers in the country. That I want to believe that even during the lockdown you were very active as an association. Let me know, what have you put your hands on in regards to mental health in the communities?
Okay, thanks very much again, and thanks to Dr. Hafsa for that elaborate discussion, and also to know that they are restructuring also to place social workers, more social workers at regional referral hospitals. Because I was asking, before I come to your question, myself, that if somebody, for example, like these ones who work on street and is disturbed, how do you prescribe medicine for such a person? Maybe if somebody is a drug addict, you find like when you go to Butavika, it is full. There are some people who have been there for more years, meaning there may be no cure for that. But if social workers in a community and then they prevent these episodes to happen, it would be the best. And is trying to talk about holistic care, which we really support as a profession. As a profession, we have tried our best during the COVID-19 lockdown. And our interventions have been, first of all, in advocacy and also capacity strengthening of people. We have advocated and also mentored younger people in Western Nile, over 200 social workers, to respond effectively with clear information based on evidence. Because when COVID came, there was no clear information and so on, and people were in disarray. So we could get information from Ministry of Health, Ministry of Gender, Ministry of World Health Organization, and also we customized that information to fit those communities. And then we share and we cascade that to help them to respond in a professional manner. So that has been advocacy, and mostly we did that in Western Nile, but also we have been using webinars. People who are not aware of webinars, these are online discussions where you invite experts and technical people. I'm happy the doctor has already shared in one of our webinars to share the best practices they do. For example, if you are here at Excel, what other TVs are doing better than what you are not doing? So even in the practice of social work, we always invite people from, let's say, those on front line of protecting children, to know maybe if Save the Children is doing something uniquely, or you said, how can I learn it and also implement it and we move at the same time. So we have been doing capacity strengthening of over 5,000 frontline social workers. We call them social workforce because there is social workers, there is also medical workers, there are teachers who are at the front line in the communities supporting and to promote resilience of families, individuals, and communities across the country. So we have also done research. I've talked about research. Working with Makerere University, we carried out a research, including Ministry of Health, in refugee settlements, to know, because some of these guidelines could not apply in some settings. Like a refugee, you are talking about social distance, where in a refugee situation all people are there and there is no way they can enforce that. You were talking about social distance, maybe washing hands where the water is not even available in some communities. So we did the research, and therefore we came up with other models which can be applied. And that research was funded by Research World International, and a report, what we call the qualitative and quantitative report, is already out, and publications are going on, and this was the first in the world. So NASWU, we are proud, like, because in the world today you cannot intervene and do effective interventions without evidence. So we have done research, we have done capacity building, we have done advocacy, but also we have also been involved in ministry activities, like I have said before. We are part of the response team in quarantine centers, and our report is now published on a global page, that is International Federation of Social Work. When you go there, they have put that Uganda report from our association as a model for the entire world.
Okay.
So that's what we have been trying to do, but also to organize and to dispel means fear and panic in society.
Okay. Dr. Hafsa,
Yes.
JohnMary does say they've been doing amazing work, but you earlier mentioned people do not need to be structured in government for them to offer a service. But when it got to COVID, there's a lockdown, and some psychosocial workers that could offer help were not cleared to move. What are your thoughts? How then do they help without having to be permitted on the road to really help?
Okay. Thank you very much for that. Yes, it happened. And by the way, I'm very grateful for the social work fraternity. They really did quite a lot, and they're continuing to do quite some good work. Yes, the social workers maybe were not given the pass, as it were, but those passes were given to people who were moving from one place to another, and mainly to go to health facilities. Like if you're a clinician or whatever, those were given. But for a social worker or for someone who was offering psychosocial support, it was truly so that some were not given, some were, by the way. And by the way, we purposed, at least for the second wave, we purposed to ensure that mental health, I think whoever was offering mental health was given a pass to go like from one place to another. And what were they doing mainly? Some of the people, most of the people, okay, I want to tell you that, I want to tell the public, for those who do not know, that the mental health facilities within the regional referral hospitals were the ones that were turned into COVID treatment centers. And what this meant was that when someone got a mental illness, they would not be able to be treated from a health facility. Instead, they would be treated maybe from home, or they would find some alternative spaces where they've placed them. And of course, this has created a lot of problems for the people who are suffering with mental illness. So what some of the civil society organizations have done, and that is very wonderful, and I want to appreciate them, they've been able to move medicines. They would like have someone's prescription. If they know that so-and-so is having a mental illness, they would then take them their medicines, and sometimes they would like carry them to the health facility, because remember, even the patients themselves coming from the communities to the health facility was also not it wasn't so easy. And you can imagine the nature of the mental illness, the nature of the illness. People are usually rowdy, and so they cannot easily move. You cannot just move them like maybe on a border. It may not be easy. So these people were able to move. The civil society members were able to move people with mental illness from their communities to the health facilities for care. And for many of them, they managed to take them their medicines. And so this was something that was good, and we gave them the passes. What I also wanted to let you know is that these people, most of the social workers or most of the psychosocial support currently is now being offered by telephone. We have shared telephone numbers, toll-free numbers. We have shared some numbers that are available for, like if you want to talk to a counselor, if you want to talk to someone, like more support, mentally or psychologically. Yes, we've been doing this like online. You do not have to walk from one place to another. So maybe that was one of the reasons why we could not just give out, whatever for everyone. Or we could have we brought it in as an alternative. Like if we are not going to move from, or we no longer have a place where we used to offer support, then we need to find an alternative. So this was another innovation that was very good for our communities, where we got telephone lines, or that we were doing now telecounseling. But also we are following up, the way we are following up our people is actually online. We are doing a lot of online, and we are very grateful to some of the houses, MTN and Airtel, where they've reduced the cost for airtime and data for some of the mental health providers who are doing it online.
So, Doctor, are you submitting that in the new home care-based guidelines by the Ministry of Health, there is an incorporation of mental health?
Exactly.
And is your submission to the fact that it is feasible for people to be mentally treated from home?
Yes, exactly. And by the way, we're even seeing more people. I imagine those who are even laughing at people who had mental illness and having, issues, that stigma and whatever. They are also realizing that they can have a similar problem, because we are seeing lots of mental illnesses during this time of COVID. I'm going to use a funny word. We don't use it in my whatever, but people are getting bonkers. Someone just feels that they cannot manage it anymore, and some have actually even got overt or that severe mental illness. People are depressed. We all live, so many people have a bit of depression, like mild and whatever, and somehow you continue to live and continue to work. But this time around, during the lockdown, it brought on quite a number of other things, and then people really become depressed. Like someone cannot eat very well, someone cannot do anything for themselves that is constructive. They cannot, they are not feeling themselves anymore, and they're only sleeping and maybe eating, and even for some, they don't even eat anymore. So like people have lost it somehow, and there's need to care for these people, and we cannot do it face to face. So the innovation of having, yes, home-based care, but online.
Okay.
And we've actually had, yes, we have a module in the home-based care strategy. We've developed a module for offering psychosocial support, and this time around we are not using. We just have a referral system, so we are not using very trained people. We are using the VHTs. We just give them like a course or two, just to orient them. Even the community leader telling them the basics, and letting them know what they can do and what they shouldn't do, and then telling them about the referrals. For those that cannot really manage, then the referrals are, we're telling them, they're giving them the linkages on how to move from one step to another.
Let me bring in Mr. JohnMary here. I see we're about to go for a quick break, but before we do that, lately, when you speak mental illness, anxieties, depression, stress, and the likes, you do not miss a word, economics, and then their financial situation in the equation. Should we distinguish between the economics and financial situations with people's mental health? Or should we say our mental health interventions now need to be more economic? People have loans in banks, people have rent to pay and the likes.
Actually, it should be wider than only looking at economics, because the general stressors, what we call environmental stressors, that put people into this situation of mental illness and also demand for mental services, even beyond economics. First of all, the fear, the parents have, like, their children at school for like 2 and so years, is stressing them so much than even some of them, than even when you compare to economics. They are stressed because now you can imagine we have 2 groups of people who are now in a senior 5. We have, I think, 2 groups who are in a senior 1 and so on. There is a lot of anxiety and fear of what the future of their children will be. And many, when you look at statistics, early pregnancies, and in northern Uganda, in eastern Uganda, it is calling upon every one of us, not only people who are in ministry or social workers, to do something to prevent, because those things like this, they spark the mental challenges people face. When you look at people now, you are talking about livelihood. People have lost livelihood, yes. When you go into town, I was looking at Kasita complaining, they want to strike, taxes, amidst COVID-19. Some people have lost business, they have loans, and loans that the banks are not also considerate. I don't know what the economics, I'm not so much an economist, But what I know with loans, that loans can be freezed, and then maybe you give somebody a particular time. People are going through stress, and these are causing, first of all, depression, and can also cause even suicides. We have seen increased suicides across the country. People have lost hope. People are becoming desperate. People are now working for survival other than being strategic. They are looking now at survival. The religious institutions, when you look, even including, I know this good TV is also under the foundation of a church. All the church leaders, they are doing work, good work in the community, they have been closed. But when you look at, yesterday I was looking at the weddings, some weddings in the town, with a lot of people without masks. So there is a lot of depression, even beyond the economics, that is going around the country. Some people in the houses since the first lockdown.
Okay.
Yes.
Now, every single day that we get is an opportunity for all of us Ugandans to make a contribution to growth and development of our beloved country, Uganda. Now, my contribution today was to host this TV show, and my guest's contribution was to come to share with us and you about mental health. And my producer's contribution this morning is to take me to a very quick commercial break.